Welcome back, everyone. School's let out, families are heading outdoors, maybe taking some vacations. But guess what? Hospitals often see a sharp increase in serious injuries during this time of year. It's a time healthcare professionals sometimes call trauma season. So joining us today is Dr. Ryan Taylor with St. David's Round Rock Medical Center and Texas Orthopedics. Thanks so much for joining us.
Absolutely.
Okay, first off, explain trauma season. What do you guys actually see this time of year?
So unofficial trauma season usually begins around spring break, right? People are going on their road trips, visiting family. The weather is warming up. In Texas, people are heading to the lake. They're heading out to the trails on their mountain bikes. Schools are starting to let off for breaks around spring break into the summer. So we're seeing a lot of outdoor activities, especially in the Austin, Round Rock, Williamson County, Travis County area. We have great outdoor spaces. So people are going to the parks, to the creeks, to Barton Springs and swimming. And as we see more people outside, we see longer daylight hours. We see people on things that they haven't seen since the winter, right? They got a new bike for Christmas and now they're on the mountain biking trails. They just signed up for a triathlon and they're gonna go do their 20-mile run. We see kids playing in the evenings on the jungle gyms and the monkey bars and everything like that. And so it's just, we have great sunny weather all summer. We have great places to be, so everybody's outside doing things, and that unfortunately results in a lot more injuries that come see us at the hospital.
Let's talk about some of those injuries. What are the common ones that you're seeing?
I see a lot of wrist fractures, elbow fractures, things where people are, on a trail on their mountain bike or just, running and misstep and put their arms out just to catch themselves, right? And that can result in fractures of the wrist, fractures of the forearm and the elbow. A clavicle fracture is very, very common in cyclists. We see a lot of lower extremity injuries when people are tripping on trails, when people are getting in and out of hikes, just still tripping around the house. We get all the injuries we normally get,
right,
with the addition of all the new stuff with people going outside for the summer. So it keeps us fairly busy.
We talked about kids, but even just before we came out from commercial break, Sally and I were saying we are at risk being a little clumsy. We've had some injuries of late. So talk to us about, are there age groups that you see more of during the summer?
So at St. David's Round Rock, we're a level 2 and we only see adults. So my practice is only adults. There are definitely different injuries where we see kids versus adults, and you get different types of injuries in a skeletally mature adolescent or adult versus a pediatric patient. So pediatric trauma, and again, not something that I do regularly, but at the same time, maybe those injuries are more treated with casts and splinting and less often with surgical intervention. So definitely different types of injuries, but definitely the same body parts, upper extremities, lower extremities, and unfortunately, the kids are involved in the motor vehicle collisions, things like that as well. So
yeah, kids are a little bit more resilient and younger than a lot of us that are going to go see you.
100%.
But let's talk about the heat. I mean, it's just so hot out there in the summer. Does that make you more vulnerable to, be, as you said, walking and miss a step or something like that?
Right, absolutely. So it gets hot and it gets hot early, right? And people always underestimate the heat. So if you're not, thinking clearly, decision making is not there, you're fatigued, you're absolutely more at risk for injuries, for trips, for falls, for whatever it is you may be doing. Absolutely, the heat plays into that. It also plays into more of our chronic type injuries we see with, the tendonitis and the overuse injuries that people get just from being more active. But absolutely, the heat plays a factor.
Okay, I'm asking as someone who, I need to find some wood to knock on here. I've never broken a bone. And so you're describing this list of injuries. Right. What should someone do in the moments after? Obviously, come see you guys, but what's your tips for if someone does injure themselves, what do they do right away? Right,
I think the biggest thing you need to do is make sure that the person's safe, right? So you're on a trail riding your bike, you fall, hurt your ankle, you can't get up. If you're not with somebody, let somebody know that you're injured. Maybe they can somehow stop traffic on the trail so there's not people still coming down on their bike. Definitely make sure that somebody has a cell phone they can call for help. In cases like these, if you're not able to move yourself, it's probably not great for someone else to move you unless you're in immediate harm, right? And so if you're in a safe spot, you've got help, put somebody in the shade, get them some water, and then call somebody that can come and help them.
And just quickly, if you don't do that right away, can you make things worse for yourself?
100%. Let's say you're out on a ride and you're in the sun, or you're hiking and you get stuck in the heat. Maybe you're running low on water because you've been out, you don't have your cell phone because you left it at home. It's just a quick ride or jog. Absolutely. If you're stuck in the heat and you can't get help or can't get somebody to help you, that can also absolutely make it worse. And then some of these injuries are unstable injuries, whatever it may be. And you know, when the first responders come, they're trained to stabilize these injuries and stabilize you medically. And so sometimes it's better just to call for help, get in a safe spot, and wait for everyone to come.
Good reminders. Be prepared and be careful out there. Dr. Taylor, thank you so much for joining us.
Absolutely, my pleasure.
We